Hey everyone, welcome to GrowMed. In this video, I will share the important topics related to the medicine subject asked in the FMGE. तो मेडिसिन एक बहुत बड़ा सब्जेक्ट है और लास्ट मोमेंट पे सारे पॉइंट्स हम कवर नहीं कर सकते उससे। तो यहाँ पर मैंने एक लिस्ट बनाई है विच इज़ अ मस्ट डू लिस्ट, क्योंकि क्वेश्चंस बहुत सारे इसी टॉपिक से रिलेटेड आ रहे हैं and the medicine is a very vast subject, so you cannot cover all the points. So this is a list of the certain important points which you must do before going to the FMGE. And as this video is going to be a little long, so I suggest you to see the video till the last so that you can come to know all the important points. तो इस वीडियो में मैंने बस वही वाले टॉपिक्स कवर किए जो रिपीटेडली पूछे गए हैं. So let's start. First important, very important and frequently asked questions from this topic, that is the jugular venous pressure. So from the JVP, the questions are asked according to the wave. There are A, C, V, X, Y wave, and you need to know which wave signifies what. Like the A wave signifies the atrial contraction, then the C wave signifies the tricuspid bulging. Okay, so you need to know all of this. And also questions are asked in which conditions. There we can see the increase in the jugular venous pressure. So this is seen in conditions like constructive pericarditis, restrictive cardiomyopathy, and third degree heart block. Normally, the jugular venous pressure decreases on inspiration, and if it increases, then it is condition. And if it is increases in the inspiration, then it is called as a positive, and this sign is seen in Kussmaul sign. This sign is called as Kussmaul sign. And you also need to know certain points like in tricuspid regurgitation, the X wave is absent, and in atrial fibrillation, to know these points related to the JVP. Then moving on to the cardiac tamponade. So it is a condition in which due to the trauma or due to the iatrogenic effect, there is accumulation of the blood around the cardia, that is in the pericardium. So questions are repeatedly asked on its management. And also we can see a Beck's triad in this. So questions are asked either on the Beck's triad or is clinical case-like questions giving all the features like the congested neck veins, BP, hypotension, and muffled heart sound. So these are the findings seen in the Beck's triad, and these features can be given in the question and asked to make the diagnosis. And moving on to the pneumothorax. So in the pneumothorax, there will be accumulation of the air in the lungs, and on the chest X-ray, you can see blackening of the lungs. Then you will be able to identify it as a pneumothorax. And the questions are mainly asked on the management. You need to insert a drainage ICD in the fifth intercostal space or the second intercostal space. Whichever is the option, you need to choose that. Okay, then moving on to the ECGs. ECG is a very important topic, and from the ECGs, one question or two questions are asked, either giving the ECG as an image or giving image along with the clinical case. You need to know the waves of the ECG, the P wave, QRS complex, the T wave, and in which diseases which kind of changes can be seen. Like in the atrial fibrillation, there is absent P wave. And if there is MI, then there will be ST elevation like this can be seen. So you need to know all these findings seen in the ECG. Then moving on to the constructive pericarditis, also a very important topic. Frequently questions are asked. These are the certain important findings of the constructive pericarditis. It is a Kussmaul sign positive. Then on the JBP, we can see the prominent X wave and the Y wave, and we can hear a pericardial knock. Questions are also asked on the most common cause, which is TB, and on the treatment, we need to give the antitubercular treatment, then steroids, and we need to do the pericardial stripping. So these were certain important points from the constructive pericarditis. Then moving on to the pleural effusion. Also, pleural effusion also is an important topic. Questions are asked, and image-based questions are asked giving a chest X-ray. On the chest X-ray, we can see a money bag appearance, and two important findings seen with this is the low voltage ECG and the electrical alternates. So questions are asked, electrical 1 minus, that electrical alternates and seen is which of the following. So you need to choose the answer as the pericardial effusion. So these are certain types of the cardiomyopathy: the hypertrophic obstructive cardiomyopathy, restrictive cardiomyopathy, dilated, and Takotsubo. So you need to know the features of this. Like in the HOCM, there is the circular hypertrophy, due to which there will be increase in the size of the left ventricle, and the cavity will look like a banana shape. Then you can see pulsus decipherings in this. And usually clinical case can be given like a young male after doing a certain vigorous activity or running, he collapsed and died. What may be the cause? And the cause will be the HCM, and it is an autosomal dominant condition. So there might be a history of his sibling also, sudden death of the sibling also. Then the restrictive cardiomyopathy, the most common cause is the amyloidosis, and due to this amyloid deposition, there will be glittery myocardium, means the shiny myocardium. And you need to remember that in this there is the small sign positive. Then another type of the cardiomyopathy, the dilated cardiomyopathy, seen most commonly in the alcoholic. The feature of this is the ventricle will dilate, leading to the heart failure. And another kind of the cardiomyopathy is the Takotsubo. This is most commonly seen in the female, and it is mostly occurs due to the stress. When there is a stress, there is an increase in the adrenaline, causing the Takotsubo. So these were certain cardiomyopathies which you need to know, and also you need to know the management of these. Then moving on, the next topic, MI, also a very important topic. So questions are asked on the changes seen in the MI, like within the seconds, so there will be hyperacute T waves, and in minutes there will be ST elevation and T wave inversion, and deep Q waves, suggesting that there is necrosis of the cardiac tissue. So questions are also asked on which wall is suffering from the ischemic attack. Like if there is inferior wall, we can see changes in the 2, 3 and the AVFs. This one is a repeatedly asked question as a one-liner or as a case-based. Okay. Then moving on to the anterior wall. If there is anterior wall involvement, then the changes will be seen in the A1, AVL, then G1 to V4. And also questions are asked on which artery is blocked. Like in the inferior, the artery blocked is the right circumflex artery, and if it is anterior, then it is left anterior descending artery which is blocked, leading to the ischemic changes. Then questions are asked also on the clinical features, like the patient will present with the chest pain, then pressing chest pain which can be radiating to the hand or jaw, and when the patient takes rest, it will relieve. And also questions are asked on the most important specific marker for the MI, and it is the troponin I. So MI overall is very large topic, so I cannot discuss all the important points here. So you need to look for all the points regarding the MI, along with the ECG changes. This is just a brief overview of how the questions are asked from the MI. Then, along with the MI, you also need to remember that the acute coronary syndrome, other things like the pentamethyl angina and the chronic stable angina. You need to even read the points clinical for this. Then moving on to the Raynaud phenomenon, it is most commonly seen in the females, and there is a triggering factor present like exposure to the cold or cold water. Then a very famous question asked from the Renal phenomenon is, what do we do for the treatment? We can use the calcium channel blockers. Every year one question from the Renal phenomenon is asked, so it is a must do topic, Renal phenomenon. Then hypertension. So questions are asked on the stages of the hypertension, along with that the hypertension emergency and the urgency, what treatment you will do, and the definition of this urgency emergency. And also frequently questions are asked on the antihypertensive drugs. So there's a class of drugs like ACE inhibitors, can the beta blockers, calcium channel blockers, and diuretics. So then give you a case presentation and ask you to make the diagnosis, or ask you the stages of the hypertension, or then moving on, infective endocarditis and rheumatic heart disease. So these are also a very important topic, and questions are asked mainly on their diagnostic criteria. Like for the infective endocarditis, we use the Duke's criteria, and for the rheumatic, we use the modified Jones criteria. So you need to know which ones come into this criteria. So like classified include the major criterion and the minor criterion. So you need to know all the points in which are coming in the major and which are coming in the minor, and how do we calculate it. Then also questions are asked on the causative agent. Like for the infective endocarditis, it is usually this causative organism for the infective endocarditis is Staph aureus, and for the rheumatic heart disease, it is the group A beta hemolytic streptococcus. And this is usually seen in the children. So there will be a clinical case, a child after a sore throat. Then features will be described and asked you to make the diagnosis. Then moving on to the aortic dissection. So questions are asked on the cause of the aortic dissection. The most common cause is the hypertension, and along with the can be seen even in the Marfan syndrome. The classical finding of the aortic dissection is on CT, you can see a tennis ball appearance. And you also need to know the classification of this, the DBK classification and the Starfall classification, classified into the A and the B. The A involving the ascending aorta and the B not involving the ascending aorta. Parts other than ascending aorta are involved, like either the descending aorta or the arc of the aorta. So these are certain points which you need to remember from the aortic dissection. So moving on to the murmurs. Then murmurs are classified into the systolic murmur and the diastolic murmur. So usually one-liners are asked which murmurs are called in the systole and the diastole. Like in the systole, you can hear the murmur of the aortic stenosis, hypertrophic hypertrophic obstructive cardiomyopathy. And in the diastolic, you can hear the murmurs of the AR, ER, and the muscle tumor. So you need to look at all the points related to the murmurs. ठीक है, स्टडी के सर्टन पॉइंट्स तो ये एक लिस्ट थी CVS से रिलेटेड सारे पॉइंट्स की. Also CVS, you need to read about the heart sounds, the S1 heart sound, S2 heart sound, S3 heart sound. Heard at which area and what does the heart sound signify? Like the heart sound S1 signifies the closure of the N1T1, then heart force signifies the oxygen of the A2 and S2 में split होता है. You need to remember the conditions in which we can see the wide split and the narrow split. So these were certain important points related to the CVS, cardiovascular system, which you need to remember from the medicine. Then moving on to the other topic, the diabetes mellitus. So from the diabetes, the questions are asked on the type, like we know there are 4 types of diabetes, type 1, then 1.5, type 2, and mellitus, type 3, and small d. So questions are asked also on complications. Like in type 1, we can see diabetic ketoacidosis, and in type 2, you can see hypoglycemic hypoosmolality. And also questions are asked on the management of the drugs. Like in type 1, you need to manage it and the insulin. So questions are asked on the type of the insulin. And for type 2, you can use oral hypoglycemic drugs. There are various hypoglycemic drugs classified into various certain groups. So you need to remember all of them. Then moving on to the congestive heart failure. So heart failure, there are certain findings seen in the right ventricular heart failure, and if there is left ventricular heart failure, there will be different findings. Like in the right ventricle, you can see the edema, liver cirrhosis, then elevated GVP. Okay, and if there is left ventricle, then it will be affecting the pulmonary arteries, there will be pulmonary edema, pulmonary artery hypertension. Okay, so based on these clinical findings, you can differentiate whether it is the right ventricle or the left ventricle. Then questions are asked on the drugs. So the drugs which you use for the treatment of the CHF are the ACE inhibitor, then the beta blockers, then diuretics are used. Questions are asked on them and also on their side effects, and if there is any contraindications, then what can be the alternative. So questions are asked like this. Then moving on, multiple myeloma, a must do topic. Every year, one question from the multiple myeloma is asked. So multiple myeloma is the tumor of the plasma cells. So questions are asked on the investigation of choice, which is the immunoglobulin electrophoresis, and on the chest X-ray, you can see certain findings like the multiple fast-track lesions in the skull. So if these findings are given in the question, like the elderly male with the bone pains and on chest X-ray multiple fast-track lesions, then you need to mark the answer as the multiple myeloma. Very, very important topic. Then moving on to the nephritis. Most commonly in the medicine, questions are asked on the post-streptococcal glomerular nephritis. There are other various types like the IgA nephropathy, which is seen in the elderly, and in the children, usually post-streptococcal glomerular nephritis. Then features are there will be a proteinuria, then there will be hematuria. Then along with that, there can be a history of the upper respiratory tract infection. So questions are asked in like a clinical case giving all these features and ask you to make the diagnosis, or they can ask you for the investigation of choice or how will you treat it, or the causative organism. So the causative organism is the group A streptococcus, and for the treatment you will need to manage it by the antibiotics. Likewise, the another syndrome seen is the nephrotic syndrome. Nephrotic syndrome, usually it is massive proteinuria. Along with that, there can be findings that there is increase in the cholesterol synthesis and there will be edema present. And there will be hypoglobulinemia, decrease in the albumin contents because they are losing from the kidney. Then the questions are asked on the types of the nephrotic syndrome. In children, the most common type is the minimal change disease, and in adults, it is membranous glomerulonephritis, and in neonates, it is the Finnish type. And if there is a HIV patient or with the immunocompromised patient, then focal segmental glomerulonephritis can be seen. So nephritis and nephrotic syndrome also a must-study topic. One question is asked every year. So these are certain points which you need to remember from the nephritic and the nephrotic syndrome. Moving on to the neuroendocrine illness. The neuroendocrine tumors like the carcinoid tumor, you need to know the features, then the investigation and how do we treat it. And the other glucogonoma, then insulinoma. So you need to know the features of this, and along with the investigation of how do you treat it. And there are certain important points like in glucogonoma, you can see necrolytic migratory arrhythmia. So you need to know if there are any points like this. Then moving on to the gout. Gout is usually due to the increased level of the uric acid, and this uric acid accumulate in the grade 2. So there can be a presentation or endemy made with the toe swellings and increase in the uric acid levels. So what is the diagnosis? You will be writing it as the gout, and questions are asked on the treatment. Like we will use the allopurinol, which inhibit the xanthine oxidase, and the questions are also asked on the acute and the chronic. If it is acute, then you will be using the non-steroidal anti-inflammatory drugs, and chronic, then you will be using the allopurinol. So these were certain points about the gout which you need to remember. Then moving on to the brain hemorrhage. Brain hemorrhage also a must do topic, asked in correlation with the surgery, then radiology, and even in the medicine or the FSM. So I have already posted a video on the brain hemorrhages, the various types, the EDH, SAD, subarachnoid hemorrhage and the subdural hemorrhage, what findings you can see on the X-ray, and along with that what treatment you need to know, and also the clinical features. So you can see the video about the brain hemorrhages. You can find it on my YouTube channel. The next, thrombus. So thrombus is formed in the DVT, and if the patient is suffering from the DVT, there will be formation of the thrombus, and it can go and settle into the pulmonary artery due to the embolism. So also there can be acute ischemic stroke. And questions are asked usually on the pulmonary thromboembolism by giving a CT scan. On the CT scan, you can see a sudden emboli, and there will be an elderly patient coming to the emergency with the shortness of breath, hemorrhage. Either they'll give you all these findings and ask you to make the diagnosis, or they will ask you to the investigation of choice, or ask you the treatment. Like I was saying for the acute ischemic stroke, in the acute ischemic stroke, the patient's the emboli will be mainly in the brain. So there will be features like weakness in the muscle, weakness in the arm or the leg. So these are certain findings, certain points you need to remember about the pulmonary embolism and the acute ischemic stroke. Then the myasthenia gravis, also a must-do topic, asked in correlation with the surgery, the pathology, फार्माकोलॉजी. सो ये एक ऐसा टॉपिक है जो सारे सब्जेक्ट में आता है, तो ये करना बहुत ज़्यादा ज़रूरी है, और माइस्थीनिया ग्रेविस से एक क्वेश्चन हर साल आया है. तो क्वेश्चंस पूछे गए हैं कि व्हाट इज़ द इन्वेस्टिगेशन विच वी विल यूज, लाइक वी विल यूज द हेटेरोफोनियम टेस्ट, एंड फॉर द इन्वेस्टिगेशन ऑफ चॉइस वी विल बी यूजिंग द ACH anti acetylcholine receptor antibodies. ठीक है. Then there will be a clinical case like a male patient. He presented to the emergency with eyes or weakness, and this increases in the evening time, and when he will take rest, it will improve on taking the rest or applying the ice pack. Then questions are asked on the treatment. So these are certain points related to the myasthenia gravis which he needs to know. Then moving on to the Guillain-Barré syndrome, it is an autoimmune condition, and there will be which will be attacking mostly the muscles and the nerves, which will be attacking most. So moving on to the Guillain-Barré syndrome, it is an autoimmune disorder attacking mainly the nerves, due to which there will be muscle weakness. So usually case-based questions are asked describing that the person is suffering from weakness, muscle weakness, coordination problems, and unable to swallow. So what will be the diagnosis? It will be the Guillain-Barré syndrome. Then also questions are asked on the treatment. And moving on to the meningitis. From the meningitis topic, you need to know the types of the meningitis, like the bacterial, the viral, tuberculosis, and the fungal, and you need to know also the causative organism. Along with that, the CSF findings, like in certain there will be increase in the protein, then decrease in the protein, and the color of the CSF. They'll give you the findings and ask you to make the diagnosis. Choose which meningitis the patient is suffering from. Big Alzheimer's disease. So questions are asked usually the clinical case by describing an old man comes with dementia. And there will be findings seen like tau protein deposition. So you need to find out these findings given in the case and make the diagnosis. And moving on to the asthma. Questions are asked one-liners like it is a reversible condition, and we can see the changes after giving the bronchodilator. The FEV1 by FVC changes are seen. And if we look for the pathology, if we take the sputum culture, then we can see the Cushman spirals and Charcot-Leyden crystals. If we see for the medicine, then questions are mainly asked on the management. Like for asthma, we will usually use inhaled corticosteroids, and along with that, we will be using the LABA and the SABA. So based on the stage of the asthma, whether it is severe or it is moderate, then you need to do the management. Then moving on to the COPD. From the COPD, questions are mainly asked. So questions are asked mainly like a clinical case. They will be saying that a patient comes to the emergency with shortness of breath, and they will give that after the bronchodilator, the FEV1 by FVC ratio will not increase. And the COPD is a irreversible airway obstruction. And moving on to the pheochromocytoma, questions are asked mainly on the clinical features, which are like the palpitations, increase in the heart rates and the BP, and what we will do for the investigation of choice. For the screening, we will do the VMA in the urine, and for the diagnosis, we will do the unfractionated metanoclines in the urine, and for the management, we will usually do the surgical management. Okay, so these are the certain points you need to remember from the pheochromocytoma. Then from the thyroid, questions are mainly asked on the hypothyroidism and the hyperthyroidism. How do we diagnose this? We diagnose mainly on the TSH levels, the T3 and the T4 levels, and findings found in that. Like in the hypothyroidism, there will be decreased metabolism. So like this, based on the features, you will be able to differentiate whether it is thyroid and hypo or hyper. And questions are also asked on the treatment. On to the headaches. So you need to know the types of the headache, like the migraine, the tension, the cluster headache, and their presentation. And like the migraine is more common in the females, and tension headache is the overall most common. Along with that, you need to know the treatment for which kind of headache, what treatment we will use. The next topic, pneumonia, also a very important topic. Questions are asked in the pneumonia on the causes. Like the most common cause is the pneumonia pneumococcus for the community-acquired pneumonia, and if it is hospital-acquired, then Staph aureus is the most common cause. If the Klebsiella is the causative organism, then we can see the red sputum. That jelly sputum can be seen, and if it is a HIV associated, then the patient will be suffering from zero vesi. Zero vesi will be the positive organism. So along with that, you need to know the management, like we will be using the antibiotic, and if it is severe pneumonia, then we need to give the O2. Then moving on, we'll see certain important topics from the rheumatology, like the SLE. It is an autoimmune condition seen most commonly in the female, and a classic presentation of this is the butterfly rash, which increases on photosensitivity, and along with that, there will be a multiple organ involvement. So here in the clinical case is asked, clinical case kind of questions is asked for the SLE, and for the management, we will use the immunocompromised drugs. Then for the rheumatoid arthritis, this is also more common in the females, and there will be involvement of the wrist joint, most commonly the wrist joint, and changes can be seen like the swan neck deformity. And questions are asked on the management, like we will use the DMARDs, conventional and the biological DMARDs, and for acute, then we will be using the NSAID and the steroid. Next topic, dermatomyositis. In the dermatomyositis, there will be involvement of the skin, and along with that, there will be involvement of even the muscle. And an important classical finding seen in the dermatomyositis is the helicotropic rash, also asked as a one-liner in the dermatology. Then there will be involvement of the muscle, and this will be also most common in the females. Then moving on, inflammatory bowel disease. There are two types, the ulcerative colitis and the Crohn's disease. So you need to know the features. Like in Crohn's disease, there will be creeping fat, and in the ulcerative colitis, there will be involvement of the complete, all the layers. That is, it will start from the rectum and it will spread retrograde. But in Crohn's disease, we can see the skip lesions. And also questions are asked on their management, like we will be using the sulfasalazine. Then moving on to the celiac sprue. Celiac sprue also an autoimmune disease. There will be autoantibodies against the intestinal lining, due to which there will be inflammation. And these are mainly due to the gluten food. So our case will be given describing all these features, like there will be inflammation, then diarrhea and weight loss. And the questions are also asked on the investigation of choice and the treatment. So these conditions like the celiac sprue, aplasia pharynx, diffuse esophageal spasm, these all conditions are also covered in the surgery. So it's better. So these conditions, the celiac sprue, aplasia, then diffuse esophageal spasm, these all the GIT symptoms can be asked in correlation with the surgery. We will read about these topics also in the surgery. So I'll just give you an overview about this here. So aplasia cardia, esophageal disorder in which there will be dilation of the esophagus, because the lower esophageal sphincter will not relax, absent a relaxation of it. So the questions are asked on the investigation of choice, which is the manometry, and treatment. How do we treat the esophageal diffuse spasm? On the chest X-ray, you can see a corkscrew appearance. Image-based question asked multiple times, this corkscrew appearance, and it is due to increase motility of the esophagus. Then vasculitis, there are various kinds of vasculitis, like the giant cell, small cell vasculitis, then medium vessel vasculitis, and the large vessel vasculitis. You need to remember in which kind of disease we can see these conditions, and it is also covered in the pathology. Then liver cirrhosis, you need to know the criteria for the liver cirrhosis, that is the 5-point score. Questions are asked on this, and you need to know that causative organism, like the most common cause is the alcohol. Along with that, it can be due to the hepatitis A or the hepatitis B, C. In the next topic, the peptic ulcer. The peptic ulcers, there are usually two kinds, the gastric ulcer and the ulcer on the duodenum. So you need to know the differentiating factors, like if the pain occurs just after eating, then it is gastric, and if the pain occurs after 1 to 2 hours of eating, then it is duodenal. And you need to know the complications of these peptic ulcers, like it can lead to the perforation and the bleeding. And also the treatment, we will be using the PPIs, and if there is perforation bleeding, then we need to do the surgical treatment. Then one-liners are asked on the anion gaps. Usually the anion gaps are classified into the high, the normal, and the low anion gap. A repeatedly asked one-liner is the normal anion gap seen in the diarrhea. So you need to remember in which conditions we can see high, in which we can see low, and in which we can see the normal. Then moving on to the ABG analysis, then give the certain values, the pH, the values of the PaCO2, and also the values of the bicarbonate. By seeing these values, you need to find out which kind of acidosis or alkalosis is present. Like the respiratory alkalosis, in that the PaCO2 value will be increased, and in the metabolic, the bicarbonate value will be increased, and based on the pH value, you need to look for the metabolic acidosis or the alkalosis. So there are a lot of topics which you need to read from the medicine, but this was only a short video on the topics repeatedly asked. Thank you so much guys for watching this video. Like the video, subscribe to my channel, and share it with your friends. Thank you. Bye-bye.